Let's see. So the first thing that we wanted to talk about is strokes and heart attacks, okay? So strokes and heart attacks, what do you guys have for that?
Cayenne.
I see, I knew you were going to talk about that. And so just quickly, I'm going to review here what it is that, let's see, what cayenne here. It's a stimulant. It increases heart rate, improves blood circulation, also stops internal bleeding. This is one way that they've recommended. Take a cup of water, add 2 teaspoons of cayenne powder to it, give this to the patient immediately if they're conscious. And then if they're not conscious, you would give them a cayenne extract and put it under their tongue. Okay, so Dana, you said that you would give them cayenne. Is that what you would do if you saw someone having a heart attack or a stroke? Have you
It
tried this?
is. Yes, I keep cayenne powder in my purse at all times. I have it in my backpack. I have some in my trunk. I keep it with me everywhere I go because it's so useful for more than even just heart attacks and strokes.
Yeah.
And then I also have tincture that I can use that way as well.
Now, first of all, I'm going to ask you, is a tincture easy to make? Can anybody make a tincture?
Yes, it's very easy.
Okay.
And there's different ways to make it too. There are those who oppose the use of alcohol extracts, and you can use glycerin in place of that. Some people also use vinegar. I'm not one who uses that. Lee could probably speak better to the tincture aspect than I can.
Well, what would be the ratio for the tincture, glycerin and cayenne? You would say like a 1 teaspoon for maybe 1 cup of glycerin? That sounds good.
It depends on the heat of the cayenne, but I would address that to Lee. I think he would have more experience with that than me.
Okay, Lee, can you share with us maybe an experience? One of you can share with us an experience that you've had with it, and then Lee can go through with us maybe how you would do a tincture.
Okay, go ahead.
Okay, did you want me to share experience?
Yeah, do you have an experience?
Okay, I mean, not personally as far as having someone who's had a heart attack, but I know of quite a few people that have used it with a heart attack.
Okay.
You know, it is very effective, and I would encourage the use of an extract or tincture over the use of powder. Not that I'm against powder. I think there's a place for it, but you know, it's hard when someone's having a heart attack. Now, they often can still drink water if they're having a heart attack, but many times it's difficult for them. So if you have an extract, it's more concentrated. You know, they don't need to take in so much fluid. And as far as the ratio goes, I'd like to use 120,000 units. If you do too much higher than that, I mean, it can be a problem more to the stomach. But then again, someone's having a heart attack, and you know, the stomach is not a big deal if they're going to die. So, but just for people to take it, put it in their mouth, you can shoot it under the tongue. As far as the ratio goes, I mean, if you're going to make this, you know, it's easier to make it first with water and then add glycerin, because anytime you use a powder, it consolidates and goes to the bottom. So there is a way to make it. You don't necessarily have to use alcohol, but I would use 120,000 units, and I would initially use a 5-to-1 ratio with water, and then I would cook that overnight and then add glycerin to that, and that way you don't have a problem with straining it. It's still strong enough to work. I would also add this, that I know people that have literally saved their life. Some people even have been pronounced dead, after even significant amounts of time, like 30 minutes. Another gentleman was dead for 30 minutes, and they use cayenne pepper on him. People don't realize, even though your heart stops, you have capillary action that continues. And if you can stimulate those capillaries, even though your heart muscle is not contracting, I mean, it does come to a point where there's no return, but you can at least buy yourself some more time. And so the cayenne is not necessarily going to stimulate the heart to start pumping again, but it can stimulate the capillaries, and it can cause vasodilation. And so for heart attacks and strokes, it's phenomenal. Another thing it's excellent for is cauterizing blood vessels. So if you have internal hemorrhaging, it is fantastic for that. So if someone's having an acute, situation like a heart attack, definitely would have cayenne. We have bottles of it. We use it we've got a first aid kit. We've in fact showed people how to do it, how to make it, but it is invaluable. It's invaluable to have. It's one of those must-have emergency remedies, because
So this is
hemorrhaging, strokes, and heart attacks, life-threatening situations, and it can really stop things very quickly in its tracks.
So Lee has an online herb shop called the American Herb Shop. Is that something that you have at the American Herb Shop?
We do, yes. We do have that available. Mm-hmm.
Okay, and so for those of you who don't, if it's new to you to prepare an extract, you can actually just get the extract. I just think Dr. Diane called me today, and she said she would try to get on, but what was happening is that her father had a stroke a few weeks ago, and she had given him cayenne at the time, and he recovered from it pretty quickly, but today apparently he was having some symptoms again. And so she wanted to let me know she would try to be here, but this is what was happening with her father. But she was the one that actually recommended that we talk about this subject of acute situations and what to do, and she was going to share about what had happened with her father and how she had used cayenne. So that's
Can I
really
mention
amazing.
two other herbs real quickly?
Mm-hmm.
If you have a stroke, this is not necessarily something you do immediately, but after they're in a rested position, you've got the emergency to help you and so forth. You can put some nutmeg in the side of the mouth that has some paralysis. Now, nutmeg is not something I generally recommend to people to take, because it's got a toxic alkaloid called marasticin, and it can even produce hallucinogenic effects if you take more than 5 grams. So it's not something I'm saying put in your apple pie or just use on a common basis. But as far as medicinal value goes, it can actually, I know of 2 cases where this has happened. It can bring back, it can remedy the paralysis that could have occurred through the stroke. All right. Now, another herb you could follow up with is the hawthorn berry, because the hawthorn berry will improve left myocardial contraction, and it will also increase ejection fraction. It will cause systemic circulation to be improved. It has calcium channel blockers, 3 ACE inhibitors. It will stimulate nitric oxide to be produced. It can lower blood pressure, but it's fantastic as a vasodilator, and it will cause the heart muscle to be strengthened, which is what you want after you've had something like a heart attack. This will definitely help you in the long term.
Thank you. I just want to explain to people what Lee, meant with like the ejection fraction. That just means that that's going to improve the strength of the heart and its ability to work and to contract. And then he talked about increasing nitric oxide. Nitric oxide is a chemical that the cells, the endothelial cells that line the blood vessels will produce. That those nitric oxide is the most potent vasodilator that is produced. And so you want to have that because you want improved circulation when you're in the middle of a stroke and a heart attack and that kind of thing. And so that's what he was saying. The hawthorn berry would be good for. So you're just saying like to take it in some form, whether it's like what form would hawthorn berry be taken?
I would personally go with the extract.
Extract
But
usually.
if, you know, you can take the tablets, it just takes hydrochloric acid for extraction, and it's not so quickly assimilated. So
So it's the
tablets
same.
have about a 38 to 52% absorption rate.
So the same thing for the nutmeg. Would you do an extract for the nutmeg?
No, with the nutmeg, you clench it. You clench it in the back of your teeth as
Clench
the
what
whole
though?
seed. So you put the
The
nutmeg,
seed.
yeah, you put it in the back and you
Isn't it the
clench it.
powder? Powder
No,
or
no,
seed?
you get the seed itself
Okay.
and you put that and you clench it in the back of your, like the back of your teeth where the, you know, the back teeth are, just clench it there and let it slowly, you know, it will mix with saliva and it will help the nerve to recover.
Somebody's asking, would that work for Bell palsy?
Yes.
Okay.
Yes, it will work for Bell palsy.
So is it just like any nerve issue that it helps with? Or is it just like if it's local to the area, or would it help like a nerve issue, like a spinal cord injury or
No,
something?
it's going to help more that localized area.
So how about if you put nutmeg over like the spinal cord injury? I'm just asking because I had a spinal cord injury.
Yeah, I don't think it's going to have the same effect.
Does it have to be right away when it happens at the beginning?
Yeah, not, it doesn't have to be the, you know, within minutes, but you know, the closer time you get, I mean, if it's just happened in the last few days, for example, that's still a good time to do it.
And
right?
you would just do it for a
you don't
short
have
period
to
of
do it
time.
the same day. What was that?
It would just be for a short period of time then, you're saying?
Yeah,
Like
yes,
it's just for like a week?
I would do it for at least a couple of days.
Somebody's asking, how long do you clench?
Well, you know, it's going to dissolve after some time. The seed itself is not that big, so it will take a few hours to finally dissolve. So you may only need 1 to 2 of those seeds per day. Again, this is not something I recommend for general use. This is only for this specific condition.
Right. Because this is a spice that actually Ellen White specifically mentions that we don't use all that often at all, right? And so,
yeah, it's just as a remedy.
Yes,
right?
There's things that Ellen White didn't recommend. Like she never recommended coffee, but she took it in seasickness. You know, and there's certain things that we would use for medicine we wouldn't necessarily use. You know, in other situations. So
yes.
There's another question. Somebody said, going back to cayenne, what does it mean, the ratio of the cayenne? So it's kind of like a 1 teaspoon to 4 teaspoons of water, right? Something like that.
Right. So basically, it's to do more with the volume. So if you can imagine like a pint jar, and you put 1/5 of that as powder in the bottom and 4/5 is water.
And then how much would you
add?
That would be
a 5 to 1 ratio.
And how much would you add it of glycerin after you cook it?
Okay, what I do is I add 2/3 of the total product as glycerin. So whatever I get as the water content, the liquid, you actually double that as glycerin. And the reason for that is because if you don't get at least 65% ratio, then there's a tendency for spoilage. So you can have bacteria or mold can build up. All right, so a herb will get degraded after about 3 days in water. All right. So if you leave a herb in water for more than 3 days, that herb will actually spoil the water, and it's not fit for use. So you have to add a preservative. You have to, glycerin is a preservative, but also it extracts. And the good thing about it is, that it's very easily absorbed. There are definitely some benefits over alcohol. I'll share some benefits of alcohol over glycerin as well, so the pros and cons. The reason people use alcohol is because, one, it's universally available. 2, it has a 5-year shelf life. 3, it's good at extracting. But the negatives are that it may be good at extracting, but it also sterilizes and denatures the plant. It can pull out some properties like toxic alkaloids that you don't want to be pulled out. So God has put some, and not all alkaloids are toxic, I want to make that clear, but most of them are. Caffeine is an alkaloid, opium is an alkaloid, morphine. And so these are chemicals in the plant that God has locked up, just like nicotine in tobacco. And he doesn't want people extracting that. Water will not extract that. Glycerin will not extract that. So some people argue for that because it's good. We can get all these pain-killing chemicals out of the plant. But a lot of these are very toxic to the nervous system. Also, they use between 80 to 100% vodka, which is usually from GMO corn. And it takes 2.5 hours to cook a tincture to get all the alcohol out. Some people think if you can just put boiling hot water over the alcohol, or it will destroy it. This is not correct. It takes 2.5 hours of cooking to get rid of the alcohol. Now, there are some alcoholic tinctures that actually have removed the alcohol. But then why would you need to use it in the first place if you're going to destroy it in the second place? So I just prefer to use glycerin. It's easier on people's physiology, on their liver. It doesn't have a longer shelf life. That's granted, 2 to 3 years at the most. But if people aren't going to use a herb for 2 or 3 years, I tell them you don't need it in the first place.
Okay. So let's ask, since we've spent like 25 minutes on cayenne, but let's just quickly ask Dana. Dana, I know that cayenne, you mentioned that. And so do you have any personal stories with that you think would be helpful?
As with Lee, not with a heart attack or a stroke myself, but we trained under Maymon Wilson as part of my medical missionary training, and he had tons of them. So he was very successful in using it to stop heart attack. And he also, with strokes, he would use not only the cayenne, but he made a tofu plaster and would pack the head in this tofu plaster. I don't remember exactly the recipe for that, but I could find it in my notes.
So you've used it mostly for then like just cuts and topically, bleeding, yes, and that kind of thing?
With great success topically.
Mm-hmm.
Yeah, I can add to that. Sorry.
Go ahead.
I was just going to say I've had the same experience. I use a lot of cayenne, and we put it in a salve.
Yes,
and it's phenomenal for arthritis. It's phenomenal for topical injuries. Best way to bring healing to any part of the body is to improve circulation, and cayenne definitely does that.
Well, that's a really good thing to know for arthritis. I think that a lot of people would be interested in how it might be helpful for pain. I tried this thing where I would put it on the bottoms of my feet at night. And I can't remember what that was supposed to be good for now.
I was in a plane one time. I was flying from America to Japan. It was a 13-hour flight, and my feet were getting cold. So I had this cayenne salve. I put it on the bottom of my feet, and I didn't feel anything for about 15 minutes. So I thought maybe I didn't put enough on. So I got some more on, and 15 minutes went by. I didn't feel anything. again, so I thought, well, maybe this is really old. So I just lavished my feet in cayenne. Didn't feel anything till I got off the plane. And I didn't realize at the time that the sweat activates the heat properties, right? So I'm start walking in the Rita airport, and my feet are like burning on fire. I had put my foot in the water fountain in the airport to I took the skin. Next day, the bottom of my foot was like skin. It was just terrible.
Well, you know, I think I
Don't
had
do
a
that.
similar kind of situation because I could have, I'm pretty sure that I think it was, you know, whoever had told me about it, they said it wouldn't burn the skin, but apparently that's not if, you know, that's only with
That's
very
not true.
judicious use. Apparently you can burn, right?
Yes.
It
One of
ca-
the things you can do is put olive oil on the skin first before you use a cayenne salve.
Well, that's good to know that it might burn. And so, because like people would swear, they'd be like, yeah, it will not burn you. It's not like doing those mustard poultices and that kind of thing. Okay, people have lots of questions about cayenne. Okay, what if you're on, some people want to know, should you take this prophylactically to prevent a heart attack or a stroke? Where do you get nutmeg seeds? Because I've only seen it as cloves. Is hawthorn berries good for atrial fibrillation maintenance in lieu of cardizem? You guys, this is not medical advice here, okay? It's just health education. So I just wanted to remind you about that. Okay, but still, who wants to answer about, you know, doing some of these things prophylactically, if it might be good for heart rhythm abnormalities, and where to get nutmeg seed? Lee, where do you get nutmeg seed?
You can get it from Mountain Rose Herbs. As far as the prophylactic side goes for cayenne pepper, yeah, I'm not a big fan of using cayenne prophylactically unless you have some, maybe if you have angina, for example, then you know, that certainly would warrant that. But yeah, I just don't believe in taking cayenne every day just for that side of things. I think you need to use it if you've got a condition that warrants it.
There was this doctor that told us that it can increase your hydrochloric acid 700 more. So you don't want to take it every day as prophylaxis, because then you ended up with gastritis and ulcers, things like that.
Yes.
But there's another question, Cayenne. What if you are on blood thinners? I think that's a very good question. But again, it's just for heart attack, right? You do whatever it takes, right? Yeah, not as a prophylaxis.
Yeah, it is a blood thinner, but it's not the strongest blood thinner. It's not like ginkgo. It's not like turmeric. It's not like red clover. The best blood thinner is water. That's the best blood thinner. But it will, if you're bleeding, if you cut yourself and all this blood's coming out, if you put cayenne on the actual wound, first of all, it won't burn you. And secondly, it will cauterize the blood vessels, and it will bring healing very quickly.
I think Mercy
it will burn you. It will burn you if you have sweat. If you have, yeah.
I think Mercy actually used, did you use cayenne or did you use ice for somebody who had esophageal varices and they were throwing up blood?
I see. Yeah, we had a lady that had a stomach ulcer that was bleeding. The stools were really dark, and she's very sick. She lost a lot of blood. Actually, she didn't want to go to the hospital, and I said you have to go to the hospital. But in the meantime, we didn't do cayenne pepper. What we did is ice water to stop the bleeding right away. So a lot of ice water, and then we did aloe. Put the aloe just to seal it, and we did the onion broth to stop the, also start healing the ulcers. that's what we did. Those are three things that we did, and it did stop, and the blood pressure stabilized because it was going down, and then after that we said just do 3 days of soft foods and juices, a lot of juices to replenish, whatever she lost, and then she did fine.
Would you think about using cayenne?
I didn't think of that, because then it's gonna bring more hydrochloric acid, aggravate the problem, because this was because probably it was too much acid to have an ulcer or whatever, it was more than that, but it couldn't be one of the issues.
Yeah.
Okay.
Yeah, I'd like to mention that you don't take cayenne pepper if you've got a stomach ulcer.
Mhm.
If you have peptic ulcers, gastritis, you don't want to use
It
cayenne
make it
pepper.
worse, yeah.
Because of the hydrochloric acid situation.
Well, it will it can burn you, right? So this is the thing about cayenne. It will cauterize it will cauterize blood vessels that are ruptured. Okay, but it won't damage the blood vessels. But if there is exposure, for example, let's say there's an ulceration, there's a peptic ulcer. Okay, then the heat can easily transfer into that and aggravate and cause pain. So you want to have ulcers protected from the heat side of things from cayenne, right?
Very good.
Yeah.
Okay, very good. Okay, so let's go on to the next thing, okay? We're gonna go here to the next thing, and that's going to be, okay, let's go to cuts and scrapes, okay? And for cuts and scrapes, I've listed onion, I've listed aloe, but we can talk about other things too.
You can add cayenne to that list too, because it
Yeah,
is
you can.
good for it.
Yeah.
And of course, comfrey.
Right.
Excellent.
Yeah.
I'd like to just comment, if I could, on comfrey just quickly. When I was at UT Pines, this was back in the early 90s, there was a gal there. I was working with Dr. Agatha, and there was a gal who had breast implants, and she wanted them removed. And she did not want to go to the hospital. And so finally, Dr. Agatha consented to remove them at UT Pines, which we did. And I took the gal home to recover her, and I have never seen a wound heal that fast using comfrey on those wounds on her breast.
Yeah, comfrey is an amazing plant. There's different forms of comfrey. All right, so you want the Symphytum officinalis is the one that I would recommend. That's what most herbalists use. The one that often they put in the category of toxicity is from the Symphytum atlanticum. It's a Russian comfrey, and it's got high levels of pyrrolizidine alkaloids. Now, comfrey has been demonized for having pyrrolizidine alkaloids. There's 3,000 different types of herbs that have pyrrolizidine alkaloids. It's funny, when I had a store in Indiana, I couldn't sell comfrey. I could sell marijuana, but I'd have to meet in a dark alley somewhere if I sell comfrey. But there's only 4 cases of comfrey toxicity that go back to the 1980s. If you look at the case studies, which I did, it's hard to know if they died from the comfrey use or if they died from the drugs. I would probably tend to say that the latter than the former. But you don't worry about the issue with the pyrrolizidine alkaloids. You would need to eat 3,000 pounds of comfrey to get the same amount that they inject in a rat to kill their liver. All right, so herbalists don't generally say take comfrey internally because they don't want the FDA breathing down their neck. So I won't say take it internally, but I will say if it were me, I wouldn't have a problem with it.
Me too.
Okay.
But comfrey is a very good plant externally as well. It's also known for setting bone very quickly. The caveat with comfrey is if you have an underlying abscess, you have an underlying infection going on that hasn't been taken care of, it will cover that, and your problem is that the abscess is still going to be there. So you need to make sure that you've cleared up and make sure there's no infection. And comfrey is such an incredible cell proliferator. I bought a comfrey plant. It was like this big. 2 weeks later, it's like this big. So it has a chemical called allantoin, and that chemical makes the cells proliferate very quickly. And that's why when you use comfrey, it heals very quickly because it initiates a cellular response of replication that is beyond natural acceleration.
That allantoin, that's also what's in onions, I think, right?
Yes, but yes.
Yes, but
onion and garlic as well.
Yeah, so Mercy actually likes to use onion when people have cuts and burns and that kind of thing. And I think she's had a lot of good results with that. I mean, comfrey, you're saying to use comfrey in the form of an ointment and that type of thing?
Yeah. The best one I found for the skin, just as a general rule, and that includes burns and cuts and bruises and infections and whatever. The best one I found is calendula. And I have used it for almost anything topically. The only thing that it didn't work on was cellulitis. And I think the reason for that is because the connective tissue, it's like cellophane around your leg. And I don't think it can penetrate so deep. But we've used it for all kinds of things. And it's amazing how quickly it works. If you've got poison ivy, if you've got some type of fungal infection on the skin, if you've got eczema.
You're saying the best thing for what? Calendula is better than comfrey?
Well, comfrey is, I'm not taking any away from comfrey saying this. Comfrey is better than calendula for if you're trying to help with bringing back tissue damage, or you've broken a bone. But it's a better cellular proliferator. But calendula works better on things like eczema, psoriasis, burned skin, things that maybe in some certain types of infection, especially fungal infections.
Right. Oregon grape is good for that too.
What was good for that too, Dana?
Oregon grape.
Yes. Yep.
Ahonia aquifolium.
And a good thing about calendula, and we're talking about marigold, this pot marigold, there's 14 different kinds of marigold, or Calendula officinalis, that's the botanical name. But this is something you can grow in your backyard, and it keeps the pests away from your vegetables.
I hear it keeps moles away. I was thinking of planting a bunch of it.
Yeah. But it's phenomenal for the skin. I could tell stories all day of using calendula for the skin, and it's just amazing stuff.
Dana?
A lot of questions coming. Can I ask very quickly?
Okay.
So comfrey, let me see. Somebody was asking, my dad had arthritis in his neck. It's been very painful recently. How can we best manage his pain? I would say, potato poultice has worked super great for us for arthritis. Even overnight, it can make a big decrease in the swelling. But you guys have any other comments? And I'll go to the next question.
Arthritis for the neck.
I would like to comment before we leave comfrey. At some point, we can come back to it. But I really have something I'd like to share, a personal experience in the comfrey. Is now the best time?
Yeah, that was a good time, but your sound is a little bit quiet.
Okay. Is that better?
Yeah.
Let's talk a little louder, put my face closer. When I worked at Anawori, the Lifestyle Center at UCHI, some of you guys probably know Don Miller, Dr. Don Miller. He was working in the wood shop and he cut off the tips of 2 of his fingers down to the bone. And he came in, and I assumed we would deaden that to clean it, but he didn't want any lidocaine. So I scrubbed it up. Dr. Calvin Thrash sent somebody back to the wood shop to look for his fingertips. We were going to take him to the emergency room, but he wouldn't go. He didn't want to go. So I gave him a whole bunch of comfrey, just powder, and I had him tap his fingertips in hydrogen peroxide and then in the comfrey. And he just kept applying the comfrey, and in 3 weeks, his fingertips regrew entirely, and he was playing guitar again. 3 weeks.
Wow. Awesome.
Wow.
So it's a powder, huh? They say powder too? Okay.
That's what we had. We just gave him some powder. He could make a tea out of it and soak, which he did, but he also just put it right into the powder. He would put a little powder in the bottom of a cup and just tap after he cleaned it. It was incredible. I'd never seen anything quite like.
And Dana, you had mentioned Oregon grape root.
Yes, it works similarly. Brother Lee was talking about calendula, and in my experience, Oregon grape root works very similarly.
So the root, you're just using the root?
Yes, for like psoriasis and eczema and things like that. You make a salve.
You make a salve with the root. So
Right.
there are places that sell this type of thing, because I haven't seen that.
Well, I'm in the process of making some right now, so you can get with me later.
Okay.
Weeks before.
Yeah, Dana makes stuff for this type of stuff too. She I bought one of your salves. I can't remember which one it was. I used it all up, but I can't remember. Was it the
It was boo-boo balm.
Boo-boo balm.
Boo-boo balm.
That's in case you have a boo-boo, right?
Big people get boo-boos too.
And Juanita said the marigolds won't keep the jackrabbits away. They ate it.
Doesn't keep everything away.
There's a question here about, I think it's important for the person that asked. My husband has to wear compression stockings as his leg had clots when he had tick disease last spring. Thankfully, the clots are gone, but destroyed his return valves. Any hope of repairing? That's a tough one. Repairing valves.
Heart valves?
Yeah. Valves from the legs.
The legs, yeah.
Arteries.
That's tough.
Yeah.
The closest proximity I could get to helping with that is using some astringent herbs like what's the one now?
Witch hazel.
Witch hazel. That's it. Witch hazel. Witch hazel or horse chestnut. So what they'll do is they'll tighten. We especially use this for ladies who've got varicose veins. So they have, poor circulation. They may be hairdressers or people that are sedentary, overweight, and so if the valves are leaky, just tightening the veins can help prevent some of that leaking. But it doesn't necessarily repair the valves. Okay, it just helps to tighten, so it could get better venous return of the blood vessel of the blood back to the heart. So that's something I would recommend, and that's a topical thing. You just rub it in, You can get witch hazel lotion or horse chestnut cream.
Doesn't aloe have some astringent properties as well?
Oh yes, absolutely, yes. Yeah, again, when I mention some herbs, it's not that I want to say this is the only thing you can. It's just,
Right.
you know, we could be here all day, all
Right.
night. Yeah, there's plenty of astringent herbs, thousands of them. But those
Somebody's asking.
are-
I'm sorry. Somebody's asking about potato for wound healing. Yeah, they can be used, but there's other things that are more powerful, I believe. Right. But I think Josh, you're gonna go. We can
Oh,
finish
okay.
when we're talking and then move to the next one. Now
Okay.
we probably
Okay,
can-
so let me just go through and just make sure we've caught everything here. So, oh, hold on. Let me. Okay. So we have aloe, onion, cayenne, comfrey. We've talked about Oregon grape. Wait. Now I'm getting confused. Is that Oregon grape good for healing cuts and scrapes and stuff, or was that for infections?
Both.
Both.
It can help
Okay.
with things.
So Oregon grape is also good for that. Mercy, you used aloe for a girl who had a lot of scrapes and that kind of thing, didn't you?
Yeah, it has gravel in the legs and then because she fell and she
Oh.
just went down and there was a lot of little tiny gravels all over. We couldn't get it. We put her in the water in the bathtub for until midnight and we tried one by one and the girl was screaming and we were so tired. So we just put aloe, the inside of the aloe with the whole thing, yeah, right? And then just put it in there and wrap it up. So the next day when we pull it, it pull everything. So it just saved us a lot of work. And then we kept putting it until it was healed. Yeah, it was something so simple to do.
Well, okay, so I want to just show you. Okay, hold on. I gotta get out of this. Hold on. Here, I'm back here. And I'm going to share the screen again. We're gonna go here. Okay, so can you see this wound cleanser?
Yeah.
So Mercy likes to use this to cleanse wounds. She makes a broth using garlic. And so she boils up 5 cloves of garlic with 2 cups of water. She boils it for 20 minutes. And then once that cools down, she uses that to clean her wounds and that kind of thing. What do you guys use to clean your wounds?
So this is very simple, because you can use normal saline, right? But what do you use if there's no normal saline? But on top of that, this is a good cleanser as a normal saline, but it has the antibacterial component, antimicrobial component. So it works so great to prevent infections with deep wounds and it's an amazing cleanser.
Okay.
I'll just
Lee?
mention something. When I was in the Philippines, we had a doctor. He was an emergency doctor, and we had him out for some training. And he said, if you haven't got anything, you cut yourself, you have some wound. If it's not serious, it's not life-threatening, you're going to bleed to death. Just let it drain a little bit. It will actually bring out a lot of those pathogens out. And a lot of times we feel like we have to stop the bleeding. Well, that's certainly true for serious cases, but you don't have to. That's the way your body will cleanse, right? But then what we do in the West, I use things like silver wound gel, for example. Sometimes use hydrogen peroxide, and then sometimes I just use a topical salve preparation with some arnica oil. We use some St. John's wort calendula oil as well in the salve, and just put that on some type of, if it's small, just a Band-Aid. If it's big, we could use a gauze. So yeah, there's just some quick things that we do to help with wounds.
In a acute situation, I was out in the middle of nowhere one time and I got bitten by a raccoon. And I just, like Brother Lee was saying, I made it bleed. I made the wound bleed. And then I I had a whole gallon of water in my car and I just poured the water over it. So don't discount just water either.
Mm.
It's a wound.
And then as far as how to, let's see, sorry. How to dress a wound. You know, Mercy loves onion. Okay. So, she will, get like not just like the peel, one of these onion peels. She'll actually, there's like a even thinner, part, you just peel it off that peel and it's like paper thin, or it's like cellophane thin.
Mm-hmm.
And she'll use that to put on top of things. I find like it doesn't stick, like you have to kind of play around with it.
Wrap it. You have to wrap it.
You have to wrap it.
Yeah, and I have a friend that can give us a testimony. I think it's a good time now about she had a very severe wound, very, very bad wound, not burn. And she's available. Do you want her?
Oh, that's Tiana?
Yeah, she's.
Okay, Tiana, are you available? You're muted though. I'm going to unmute you. I'm going to ask you to unmute. Let's see. Okay. How are you?
She has a picture also.
Now she's, hold on.
Okay, unmute. Does that work?
Yes.
Yeah. We seen you.
Okay.
Now. Awesome.
Okay, so what I want to do is actually want to show pictures, and since I'm on my phone, it's going to be tough. But yes, I'm going to try and turn. Tell me if you can see the burn.
Yeah.
Yes.
So actually, ironically, I was trying to do a hot foot bath for a headache, and I accidentally poured boiling water. The water had just been boiling, and I went to pour it in my bucket, and I poured it on my leg instead.
Mm-hmm.
Oh,
And
my.
so initially what I did, and I obviously didn't know what I was doing, but with Mercy's help, so this is the onion wrap. So initially what I did was I put it in cold water to stop the burn. And with boiling water, you can have really severe burns. And I didn't really know how bad the burn was going to be. I'm actually a nurse, and when I would go to work, I went to work every day. And this burn never hurt. It was that bad. I never had any pain. And all of the doctors I worked with begged me to go see a surgeon. You're probably going to have skin grafts. I actually had the wound care nurse come and look at it, and she was telling me about all the dangers I could have with this burn. And I didn't. What I did was I put the onion, and did you see the picture before?
Mm-hmm.
With the skin? So I peel the inside layers of the onion and put it over the burn. And I would do this dressing twice a day. And the skin was intact initially. I did this twice a day, and I would wrap it. I would put cabbage over it. I'd break up cabbage. I'd put the cabbage over it. I'd wrap it. And then when I was at work, I would do this again. And after, I think it was about day 10, you can see it begins to become infected, which I was surprised. It was closed at the time. And so Mercy I was at work, and I was terrified because I really had no idea what was going on underneath the burn. And so I drained it out, and I had a coworker, she had to go home, and I said, bring me a potato and a grater. And we were just so busy, I couldn't leave work. So she comes back several hours later with the potato and the grater. So I drain all the infective material out, and I grate the potato. I put it right on top of the whole thing, wrap it up, and about 6 hours later, I arrive and I take off the dressing, and you can see all of the infection is gone. The potato took all the infection out, but we still had no idea what was going underneath the wound there. Now the skin was open, so at this time, I used, here's a picture with the cabbage, how I'd put the cabbage on it. I used There's comfrey salve. So comfrey's been talked about, yes, and it was wonderful. And it does have the calendula in there as well. So once it broke open, that's what I started using was the comfrey. I also used as a cleanser, you can see in this picture, the liquid up there, that was the garlic tea that I would use to cleanse it with. And then I'd put the calendula on, and then I'd wrap it again with the cabbage. And then this is a picture, not that long afterwards. You can see here's where the burn was. And actually right now you can almost not even tell I have the burn. The only time you can notice that there's a burn is if my leg gets exposed to the sun. The skin, it colors a little different than, like my skin, the regular skin does. But the burn is virtually, there's no scarring. And the interesting thing was, especially when it got infected, the doctor was begging me, please take an antibiotic, please. He was begging me. And later, another doctor I told the story about, she said, well, you took an antibiotic, didn't you? And I said, yes, I was taking garlic. And so God's ways work, always.
Amen, amen. Thank you for sharing.
Yes,
Diane.
you're welcome.
Yeah, thank you.
Awesome testimony.
Yeah.
So for burns, I found out that the onion is amazing. Let's say if you have a really super bad wound, because when Diana called me, it went by some time because we were busy filming something here with Dr. Joyce, Dr. Bill, and Ron Maynard here. That's why she was calling me in the middle of it. So I couldn't answer right away. And because if you burn yourself, if you put the onion immediately, it cannot regenerate it right away. And then after that, it's almost nothing. It's like nothing happened. It's amazing because I burn myself. Because in the past I used not to cook. I didn't know how to cook at all. So I was helping my mom to get a pot out of the oven. So I put my hand into the oven and just removed the pot. And then so I burned my hand and I just lifted up and burned my hand. So at that time we put an onion in my hand. I just closed my hand and I thought I was going to go to the ER and I'm not going to be able to work for who knows how long, things like that. So I just kept the onion there and grabbed it. But after a while, I think it was 2 hours, so an hour or 2 hours, I opened up my hand. It was nothing. It was a little white maybe. So, so since that time, I started using the onion for any type of burns. And it's been amazing, really helpful.
Thank you. Thank you, Tiana, and thank you, Mercy. And then does anybody else have any favorites that they like to use for burns?
I think everybody knows about aloe for burns. I was in Ukraine once and I was doing some missionary work there, and a guy had opened a radiator on a vehicle that was hot, and it spewed that hot liquid all over his arm. And we just laid large pieces of aloe over, and it was amazing how fast it healed and had no infection.
Amen.
Yeah, I was going to say aloe as well. Another one is Manuka honey.
Yes.
And we made a Manuka honey salve. And when I went to the Philippines with my family, it was very strong. The sun, it was easy to get burned. Our kids would get burned. We applied that. Even though they're terribly burned, the next day, even their skin wasn't coming off. It's very soothing, healing. Another one you can add to it is a peppermint oil. It has a very cooling effect, and lavender is another excellent one. There are others, but those are very effective for
yeah burn. Lavender, I mean, that was something that who was it that is there an invent? Someone who discovered the
French chemist
healing properties. Yeah, that French chemist.
Yeah, he put his hand in the lavender oil. He was in a lab and he didn't have any side effects.
Yeah. You know what I found to be really helpful for burns, at least the burns that I I had a real severe burn when I went to India. It was really cold, and a friend of mine, filled up some plastic water bottles with hot scalding water, and I put it into my sleeping bag. And I was so tired. I'd just gotten there, and I didn't realize that it was burning a hole through my leg. And so I had the same, it was a real bad burn. I almost needed skin grafts. I needed debridement every week for like 2 months for it. And I was in India, so I had some charcoal, I had some honey, and that kind of thing. So I was just using that kind of stuff. If I'd had aloe, if I'd had, like the onion, if I'd known about the onion, I would have done that. Something that I found to be helpful for burns, as far as like, this will really take the pain away. Like even for me with aloe, it doesn't take the pain as much as this did for me. So you can take it or leave it. But do you guys use a lot of clay?
Yeah.
And so I will slather on some clay when I get burned. And as long as I put something wet on top of it so that it stays wet, throughout the time that I need it to, it takes away the pain totally, and it helps it heal a lot faster and that kind of thing for me. So you just have to be careful. You don't want it to dry, because then it'll be painful when you take it off. And someone asked, what kind of clay? This is Miracle Mud Clay, pharmaceutical. There's living clay. There's Pascalite clay. There's all kinds of clay that you can use. I think the living clay, they don't have like a lot of heavy metals and that kind of thing. But I've used a lot of clay. Bentonite. They're all I think a bentonite clay, these ones.
Right. Yeah.
Versus what other kinds of clay?
Well, there's quite a few different clays out there. But the majority of clay that's used medicinally is usually the bentonite or green clay or French clay. It's another name.
Right.
Or the French clay or green clay tends to be better for the skin. It's got smaller. It's a smaller powder. It penetrates in the pores better. That's why it's used for the top cosmetic products in the world have green clay.
Yes. Well, okay. And this is the other thing about clay. Like when I found out how great clay was, I was putting it in everything.
Yeah.
And I would put it in my oils and put it on my face, and it seems to help with like, just the complexion.
Yeah. It's like a vacuum cleaner. I used to sell it at our store, and you could put clay in an aluminum bowl, and it will pull the aluminum into the clay. That's how strong it is. It's like a vacuum cleaner on your skin.
Every time I talk about it, I think I really need to start using these things again. Like I get kind of lazy, but you know what I do use that's really good for the skin is frankincense oil.
Yes.
Frankincense, it's like it'll fight tumors, right? And so I thought, well, all these little things that are coming out as you get older, right? It might help with that. And so I started mixing it. I'll take a drop of frankincense oil and I'll just mix it with like even the boo-boo balm. I think that's how I used it all up, Dana. I would use the boo-boo balm with frankincense oil. I'd just like rub it all over my face, and I kid you not, it really helps with the aging spots.
Yes, it's very good for dark spots. There's 6 different types of frankincense. I don't know if that was the one we sent you, but it was Boswellia serrata, if it was. But frankincense is very good for the skin. It's very good for infections, and it's very, very good for stress and anxiety. And in fact, it was used for the anointing oil. If you read, and it talks about in Timothy, if any sick among you, let him call the elders and anoint him with oil. Well, that oil was an infused olive oil preparation with frankincense oil. And so it was used for the purpose of healing and anointings.
Yes.
So
Well, I thought if it's good enough for Jesus, it's good enough
Yeah.
for me.
yeah,
Right. But you know, like someone says frankincense needs mixing with a carrier. I think I got a little burned. Yeah, definitely you don't want to put it on topically without mixing it with an oil.
5% to the carrier oil.
5% to the carrier
5%.
oil. And so, yeah, I do put it in with a lot of oil. And Dana says to diffuse it is good for stress. You can also take a drop under the tongue. And, you know, to be honest with you, it's not something that like when I've done that I'd be like, oh, I feel better. Some people, I think that they've had that experience with it for pain or for stress or that kind of thing. And I can't tell you that I have felt that way with it, but I can tell you that it really, I've noticed a difference with the skin.
Somebody's asking on Facebook, would oregano tea work for cleansing wounds? I think it will be great if it's tea, it's not concentrated, because if you use in wounds the essential oil, it will burn. I don't think it's a good thing at all. But if it's just tea with oregano, just make a tea out of oregano leaves. I think it will be great for cleansing if you don't have garlic at that time, because garlic is so simple, so easy. So
Yeah.
but,
Can I just follow up with a comment on that? Because this is a really important subject. A lot of people think that they can just take internally essential oils and it's not a problem. A lot of this information is coming from multi-level marketing companies. Now, I'm not promoting one over the other. That I believe there's a lot of good oils. However, this concept of taking it internally, now there may be specific conditions that could allow for that, but generally speaking, they're very, very strong and concentrated. They're 1,000 times stronger than you find in their natural setting. And so, you know, you got all this concentrated, and now these are not the whole properties of the plant. It's not like an extract. It's not like a tea. You're only isolating the volatile oils. These are alcohols, they're esters, they're phytochemistry, and they're very, very concentrated. They're called reactive oils because they're highly volatile. And so when you put them in the stomach, like oregano oil, for example, there was a lady, she took 4 drops, she ended up in the ER just taking that. I've had people in my store, they have had kidney stones from taking too many essential oils. So be very careful. You know, if in doubt, go without. But they're fantastic for breathing in, and they're fantastic for using topically. But just be very careful taking them internally.
I have to say,
Lee's wife said that my skin looks good now. She says, my skin looks like a China doll. So I've convinced everybody about clay and frankincense. Thank you, Amy. And I just want to let you know, if you guys have seen my blog, drjoycechad.com, you know that I had terrible looking skin for much of 2020. And so for me to have skin that looks normal is by the grace of God and through these natural remedies and lifestyle. And my friend Mercy Ballard, who took care of me for almost 2 months. And so I praise the Lord.
Yeah, you have a beautiful skin. So, you know, I think doing all these simple things can really improve our skin also. Like myself, I like to use frankincense, and the carrier I use is what is the other oil, organic oil that comes from
Almond oil, apricot oil,
coconut, almond.
Almond. So I do 9 portions of organic almond oil and 1 portion of frankincense oil. No. That's it. That's all I use. I've been using this since I met Joyce. When, you know, she told me she was using that. So I've been using that for how many years? 5 years, 4 years, 5 years. So it's helped my wrinkles. So, you know, something so simple.
So Yes. And for those of you who are wondering like how to have a good complexion and stay young, beauty, I think, really starts in the inside, right? And
Yeah.
so when we eat the way we should be eating, when we drink and all of these things, it really helps. And then this other stuff, you don't have to spend a whole lot of money on that cream and everything, right? We can save our money and send it to do God's work.
Amen.
Okay, so let's see. Oh, someone's asking, they've asked a couple of times, what do you do for gout?
Yes.
Okay. Who do you want?
You know, for gout, Dr. Bill, maybe he's here. He usually follows our. He said that for gout, it helped at just drinking the turmeric for the gout. That as simple as that. He said was powerful. Just drinking. I think he did 1 or 2 teaspoons with a meal, and that did help the gout. Of course, for the gout, you have to remove the causes, right? You have to remove all the unhealthy foods and inflammatory foods you might be eating that's causing it. But you know, the remedy will be
So that was turmeric powder.
turmeric powder. Yeah.
Yeah. Now, with the gout, it's often in the big toe, and the reason for that is because that's the coolest part of the body. But you've got uric acid that's building up there, and so if you dilate the small capillaries, you can offset some of the rouleau effect that's causing the blood vessels to be sandwiched with all this uric acid. So you can help flush some of that uric acid out with hot and cold treatments in the feet. You can also use clay packs to the feet. Also, definitely turmeric is so good at anti-inflammatory, and also cherry juice is another one that's often recommended. You want to make sure that you don't take the commercial one. You've got to be 100% pure. I would recommend the organic one for that. But yeah, some people also use charcoal. I just want to mention about charcoal versus clay. Charcoal is better internally than clay. Clay is better externally than charcoal. Not that you can't use, either other way around, but
You like her.
clay has a better drawing ability, a better action, even than charcoal topically. It's very strong. So you may want to use clay for as a pack over the area that's afflicted with gout. So.
Okay, that was another question. How about for sciatica nerve?
Do you want to tackle that one? I could throw in a few sentences.
Yeah, go ahead. Go ahead.
You know, this is the thing about sciatica, and I think we have is it Marcia Somerville? We were just talking about this. She's a massage therapist, and so we're talking about how a lot of times when people have these symptoms, they think that it's just that one area that is affected. Like I have sciatica type pain, but it's because my bite is off. And if my bite is different, it will realign my spines as such that I don't have the sciatica. And so me going through all this stuff with my teeth, it's made me aware just how much my teeth are affecting my neck pain, and my posture, the way that I walk. My rib cage will change, which muscles are tight or not. It'll affect my gut, what if I have the food sensitivities and that kind of thing. And that's just all from my teeth. And that bite can change as we get older, right? People are losing teeth as they get older. They're clenching. That's going to change things. So your stress level, all of these things, if you get a filling, all of that is going to change things. And so when people are like, oh, I just woke up and I have this problem now, it's not always just at that level. You might want to be looking at, the spine, and it might be an ascending problem, or it might be a descending problem. It could be from an old injury or that type of thing. And so I would just say to look at all these things. And I don't know if Marcia is on somewhere, Marcia Somerville. If you want to unmute and add something to that. And if not, then Lee, did you have something?
For sciatica, did we, for nerve, what Ron Meinhardt uses is cayenne pepper, kind of like make a little poultice. It can burn, so you have to kind of, mix it in with maybe psyllium, and just be sure that it's not burning. So it makes the right ratio. Also, ginger poultices can work. But, if it's a pinched nerve, you have to unpinch it, right?
That's right.
Mm-hmm.
I mean, you have to take care of the problem. So I will, something, I had a pinched nerve for a whole summer because I was working in my yard here, building up when I started building the ministry with trees and carrying rocks, heavy rocks with, buckets of, so I really hurt my back. I was out for the summer and I couldn't even go to church, couldn't even sit up. It was that bad. And then some therapist was trying to work on it. It didn't do any good. You know what worked? That upside down table. What is that called?
Inversion table.
Inversion table. Table. I did one time and I was better, like a 50%. And I kept doing, but by the end of the week, I was 90%, 95% better. It was just so amazing, so simple. The table only cost $100. So to me, that really did it.
Yeah, and there are some exercises you can do. I can't demonstrate them here, but you tuck your knees into your chest and you rock backwards and forwards, and then you also lie down on your face down and pretend like you're pushing up, except you don't do a push up, you just arch your back and push yourself back. Okay, and just keep it there for about 20 seconds or so, and then do that a few times. That can help relieve some of the pressure that's on there. As far as if you're looking at pain relief for anything like this botanical, another excellent herb is called Jamaican dogwood. Jamaican dogwood is not very commonly known in herbal circles, but it's exceptionally good for pain, and we've used it in severe pain with nerve pain. We've used it for surgery pain. We've used it for cancer pain, even tooth pain. It's just been phenomenal.
Do you take topically, or how do you do it?
We take it internally.
Oh, you take it internally?
Yeah, I had a friend of mine. He was working with a circular saw, and he was holding it with one hand and trying to cut wood, and it backfired and went straight in his groin and severed his scrotum and nearly severed his femoral artery. And
wow,
he was in extreme pain. He nearly died, and so I sent him some of our pain relief, and he was back teaching a few days later. He said he came off all these pain drugs, and he was amazed. And that's just one story. I could tell you many more, but
that's amazing. So do you have that?
We do. It's an internal preparation. We use it with Jamaica, with the devil's claw, as well as the Jamaican dogwood. We use it a little bit with turmeric. We use it with cayenne as well, and a little bit of red clover. And it works phenomenally for pain. And this is a big problem that we have, because we always look to modern pharmaceuticals for acute situations, for emergencies. And I'm not against that per se, but if we knew what we could use, on hand, we certainly wouldn't need so many painkillers,
So,
because
so does it work very quickly? This?
it does. Yeah, it works. It works quite quickly. Yes. The
Oh,
problem
okay.
with painkillers is that people don't realize it doesn't lessen the pain. What it does, it increases your tolerance to pain, and that's completely different. So when it wears off, you actually need more to get more. You build up your threshold. And so even the pain experts are saying the more you're on painkiller medication, the more pain you're going to have over time.
So how does this work differently?
Well, let me tell you something. God is always one step ahead of the pharmacist
Just
and the
one step.
chemist. And in this particular case, I can't even tell you how it works. As far as, I mean, normally we're able to give some of the chemistry and everything, but I can't tell you this one. It's a mystery to me. I mean, I could give you an easy answer like, well, it's anti-inflammatory, it's good for the nerves, but the actual chemical, biochemistry of it, it's a bit of a mystery.
Wow, that's very interesting. Never heard of that. That's very interesting. Did someone have a comment that I interrupted? Mercy, did you have something?
Yes, it was me.
Oh, Dana.
Mercy, were you saying something too?
It doesn't seem.
Go ahead. No,
Okay.
go ahead.
I just have a personal experience with the Jamaica dogwood. We have a blend called herbal morphine with, I think there's 5 herbs in it.
Oh, great.
Kava kava is one of them, Jamaica dogwood. I can't remember all of them, but I can type it in the comments.
Okay.
But
That's something to take internally?
Yes. We had a patient that was, when we got him, he was late stage 4 cancer, and there was really not much left for us to work with. He did not survive, but we did basically palliative care. But that blend, he did not have to use any medication right up until the end of his life.
Praise the Lord. We need that. We need that.
Yeah.
I'll
because
put
a lot of people had to go and take these heavy duty medications that we want to try to avoid. So things like that will be so great.
Yeah.
So it won't have the, oh, I'm sorry, Mercy. Yeah. I was just wondering if it didn't have the effect on the liver or kidney or that kind of thing. Is it?
No, it doesn't.
Awesome.
Let me share this with you. Kava is, if you look online, you'll find a lot of backlash about kava causing liver toxicity. This is not true. This was, if you do deep research on it, you'll find that people didn't get liver toxicity from the kava root. They got it from the kava peelings. It was contaminated kava. And this all happened at the same time about 20 years ago, all within the space of a few months. It was actually the pharmaceutical company's fault with this. But kava is psychoactive, but it's not psychotropic. So it won't actually cause you to have a experience of being high, but it does cause muscle relaxing effects, and it also does give you more composure, and it's very good for stress, and it's very good for insomnia that is caused through the stress response or anxiety. You just don't want to take it with certain anti-anxiolytic medication, because it can be a problem with that. But and you shouldn't take it if you're going to drive in a short time after that.
Is kava from like South America or something like
from
that?
Vanuatu and the South Pacific Islands.
Okay, so this is a question that I have for you. Like, how it's good to eat according to where you live and your season, right, and that kind of thing. Do you think the same thing about herbs? Like, should we try to get herbs from where we live? Do you think that God has herbs for us that are local for us, or do we have to go to South America and that kind of thing? I'm just asking you because, I know in our cookbook we have a lot of coconut, and we don't grow coconut here in Portland, right? And so I know that we should be trying to figure out how to
Yeah.
eat more local and all that kind of stuff. But I was just curious. This is not
Well,
like a.
This is just my opinion. It's only my opinion on this subject. But there's not one herb that, if it was to go in extinction, could not be replaced by something else. So certainly use things you have locally, and if we learn more about our local herbs, we would be not needing so many
Things
herbs
shipped.
from other
Yeah.
areas.
Yes.
That being said, I don't think it's a problem, taking something from another area that has very good
Yes.
remedial properties for a specific condition.
Because I think sometimes when we hear about these things, we're like, oh, we jump on it and we think like that herb is going to save me. And so I just want to, I know not our group here, because everyone here, it seems very advanced in their.
Yeah. So lifestyle is the basics, right? And then this is just an addition to the lifestyle.
Absolutely.
Somebody's asking about what is good for vertigo? It can be, we have to find the roots, right, of the vertigo. It can be many things. It can be ear infection. It can be some brain issue. It can be, so I start with my ears, have the doctor checking your ears to see, you might have an infection. You might have a lot of wax there. If that's not helping, maybe go check into your brain. You're gonna have to go deeper.
And I would say, as someone who's had these major, like I didn't even realize I had TMJ, but going through all this because of my injuries and that kind of thing, if my bite is not on right, I will develop kind of vertigo and inner ear issues and that type of thing. So just everything is very connected. And so I'd really recommend it that people check out a TMJ specialist or something if they're having some of these issues, rather than like if someone says you need surgery or something significant like that, make sure you check it out deeper.
Now,
There's a question. Go ahead. Then I'll go.
If it's an infection, you can put some frankincense oil behind the ear. Okay, if the infection.
Oh, you're talking about ear infection.
Yes, if it's causing the vertigo. Okay, but another herb that is often used for vertigo is ginkgo biloba. Now, it's often used mainly for Alzheimer's or dementia or improving brain function.
Circulation to the brain.
It does, yeah. So the best way to bring healing to any part of the body is to increase circulation. So ginkgo can do that. This doesn't cover everything about vertigo, but as was mentioned, you got to get to the cause. But often it's circulation problem. Often it's an infection problem. So if you can, you may be able to rule out that by if you already got those herbs or.
Well, since you're talking about the ear, can we talk about what to do about ear infections? You said frankincense, you would apply frankincense. And I remember when I first started learning about essential oils, I had just gotten a kit. And I was super excited about this. I brought them everywhere I went. And I went to church, and there was a little 4-year-old girl who was crying, and her mother said she had just gotten an ear infection, and that's why she was crying. So I just put every single one of those essential oils on her ears. Just put every single one. And she quit having pain like right away. And then I called her dad and asked how she was doing. He said, yeah, she's doing fine, no problem. So that was one case in which, something as simple as essential oils did help. Now, sometimes they might not work that way. So do you have any other suggestions?
Oregano, right? You wouldn't use oregano in the ear, right?
That didn't come in the kit. That didn't.
Good. Something that we use. I had a lady that came to our lifestyle center that had a very severe ear infection. Just came out of the hospital because internal ear infection, and then she was having pain again. So I didn't want her to go to the hospital again. So what I did is 1 clove of garlic, I just press it and then put in a cloth and just got about maybe a few drops of the oil, and then mix those with 1 teaspoon of olive oil. And then we put 3 drops of those in the ear. So we did that 3 times a day, and that did it. So she did very good, very efficient. But somebody has a very mild ear infection, so we can put just a clove, right? So the
You put
fumes.
a clove.
Oh, I did that for a girl that was having ear pain. So I just put a clove there, and she was fine. So
You have to be kind of careful with the clove and putting it in the ear, so that, you know, it has to be a child that's not going to jam it into their ear. So you might take a little risk with that. So, you know, some people recommend heating up an onion and putting onion right up against the ear. Has anyone tried that?
Yes, it's very effective.
I think it would be very soothing. I think I asked my mother to do that when she had an ear infection, and she said it worked great.
And even heat, just heat. Yeah, even
Yes.
if you had a lamp, just shining on that
Right.
area.
Right.
Hydrotherapy is very effective.
Maybe
And
going outside into the sunshine and allowing the sun to hit your ear.
yeah, and if you put the olive oil with the garlic in, just make sure it's the same. It's warm. You want it the same temperature, because it could produce a little nausea if you don't have it the right temperature when you insert it in the ear. And then
That's a good
you want to
suggestion.
hold it for a short amount of time, and then you drain it. So you don't need to. You need, yeah, just a little.
You know, I'd like to comment, Brother Lee, you said something about even just heat. And the way you said that was very interesting. And I think it's a point that we often overlook. And that is, we don't always have to jump to a fancy remedy.
Yeah.
Sometimes the simpler, the better.
Yep.
It doesn't have to be complicated.
Yes.
Right.
Yeah. Michelle Harding she used baked onion for the ear, charcoal poultice over the ear, hot half bath for earache. Hot half bath. What's a hot half bath? Hot half bath.
Maybe heating all the way to the waist, maybe.
Oh, yeah. Okay. Maybe just taking a hot bath or something like that. Okay.
Yeah. We have a lot of questions coming up, but I don't want to miss some that seem very important. Somebody is asking any suggestion for eyesight. You know, I would say, you know, juices, green juices, half carrot, half green, and also turmeric. I heard that some people say that the turmeric really improved the eyesight, and the juices. Also, one lady that was able to read without glasses after drinking the juices. So those could be 2 things that you could do. I want to comment on this because I have a few people that I help with this severe menstrual pain. Okay, this is a very an imbalance of the hormones, right? So we had to follow a very strict lifestyle and very good diet. On top of that, but the remedy, what we did for this lady is that we put her in the bathtub. This lady will faint because of the pain. It was totally out. And so we didn't that to happen in our lifestyle. So what we did is, okay, we heat the bathtub really hot, so to what she could tolerate. So she will lay there, and we put 2 cups of real salt. So that's minerals, right? 2 cups. It was all the minerals. It wasn't just Epsom salt. It was 2 cups of real salt. So we put it in there, and that did it. Completely took away the pain. So we have her do it every day for the time that she needed. And because she had to take hormones for that, she had to, you know,
Didn't she take some narcotics? She took some opioid, didn't she, for the pain?
I think so, but also a lot of hormones to balance, and they thought that they will help, but it wasn't helping at all. So that did it. And then after that, because she followed a very great lifestyle and menu food, and I mean, yeah, she did great.
You mean she followed your menu?
I can tell you a herb that works every time for menstrual cramps.
What works?
It's called cramp bark.
Cranback. What is the name?
Cramp bark,
Bark. Yeah. Cramp
B-A-R-K.
CRAMPBARK.
Thank you.
It will take maybe half an hour to an hour to work, but you have to do a decoction because it's a bark. So you bring it to a boil and let simmer for 20 minutes. But it's the best herbal remedy for cramping, severe menstrual cramping.
Oh, wow. And you have that one too?
Every time we've used it, it's worked. Different ladies. Yeah. And yeah, you just got to make sure you get the right amount. That's all.
And what's the
Doesn't
right
taste
amount?
good. Well, let me tell you about herbs. It's as much an art as it is a science. So it's not like a cookie cutter. You can just say for everyone, take 1 teaspoon, So dosage varies according to weight, according to this person's sensitivity. If they're sensitive to medications, usually they're sensitive to herbs as well. It also depends on the condition and the severity of the condition and the form in which it's given. So as a decoction, generally if it's a severe case, when we've had severe cases, had a woman not so long ago in the clinic here, she was crying, just a grown woman, just crying, just so much pain. So I made it a little bit stronger than normal. I actually made 2 tablespoons. Usually I would just 1 tablespoon would be sufficient for most people, but please don't take this as specific advice because it can vary person to person. But yeah, it worked within a few minutes. She was able to calm down, stop crying. But if you've got an extract, that works fast as well. So usually as an extract, it would be maybe 1 to 3 mLs, something like that, depending on how strong it is. But
so you have that at the American Herb Shop, you're saying?
we have the bark. Yeah, we don't actually have the extract, but we have the bark.
Cramp bark. Someone
Yeah.
was also saying nettle tea. Do they mean nettle tea?
Nettle, you can. It's not as strong because here's the thing: cramp bark is antispasmodic. So nettle doesn't have the antispasmodic effects that cramp bark does. All right. But I mean, you can certainly use it. It's definitely, it wouldn't hurt. In fact, nettle is one of our top herbs for nutrition. And you mentioned eyes before. Nettle is one of the best for eyes. It's very high in vitamin A. It's got vitamin A, B, C, D, E, K, and P. It's one of the highest sources of plant protein and iron. It's got micro minerals. It's
what was that you said?
Nettle. This is stinging nettle.
Oh, nettle.
Urtica duacia is the botanical name, but it's basically common stinging nettle. So you put your hands in nettle, it will sting you. It's got formic acid in there, but if you cook it or dry it, it will denature the formic acid and it will actually take away the allergy it caused you because it's got natural antihistamine properties in there. But it's what we call tropho-restorative. It means it helps every body system. So it's very good for any kind of system that you're trying to use it for. But specifically, it's good for allergies. Specifically, it's good for also eyes, skin, hormones. It's anti-inflammatory. It's good for the blood pressure. It will drop blood sugar. We've had people, and I'm not making this up, they've been completely bald and their hair's just grown back just using nettle.
Whoa, wow.
It's very good for, yep.
I used to grow lots of nettle in my old house, and I'm thinking of sneaking back and getting some nettle to plant in my place here.
It's the highest source of nutrition of any food or herb on the planet that we know of.
That's what I hear, and I was so surprised I don't have it at my new place. But
Yeah.
okay, Marcia Somerville is saying red raspberry tea is excellent for
Yeah.
periods as well. Would you recommend that too, Lee? Have you?
Yes, red raspberry is very good for ladies who are also pregnant.
And then how about parsley for Andrew Rice is saying parsley, cramp bark, black haw, and buchu for low menstruation. What does that mean, low menstruation?
I don't know what he means by low menstruation.
To decrease the amount of flow blood.
Oh, yeah. To
He said the
decrease.
parsley for painful or scanty menstruation.
I'm just trying to find out where he posted that.
Yeah, he's on Facebook.
Oh, okay.
But he was saying to give them equal parts parsley, cramp bark, black haw, and buchu.
To slow menstrual flow?
No, to help improve menstrual flow, it sounds like.
Menstrual flow.
And for painful.
Yes. Yep.
Okay. There's another question. How about migraines? I can mention a little bit. Migraines is usually related to food sensitivities. So I will get off of all those foods that, we call it the big fives, the oats and gluten and soy, corn and yeast. Usually those are the big problems. It can be also nightshades. So I will remove all those. You can follow, we have a menu that you can follow. It'll be easy that way. And migraines usually are gone after following that diet. Do you have any other suggestions?
Yeah, and so now it's, what time is it? It's 4:40. So, okay, we don't have much time here. Dr. Diane got back on. I don't know if she is available or not, but Dr. Diane, if you wanted to jump on and just add anything, feel free to jump on and add something. And Dr. Diane, yeah,
I'm here.
okay.
I'm here.
Have you been listening? How is your dad doing?
He's doing better. So I would say that it was I got cayenne tincture in him. And I would say within 10 minutes his muttering and his weakness and confusion was almost resolved.
Amen.
So
praise the
Lord. He's still kind of touch and go. I'm really watching him, but anyway, so that was like, wow. The last time, a few weeks ago, he had a stroke and he was totally paralyzed on the right side. And all I had available was the cayenne powder. And I knew he wouldn't be able to swallow. He was in such bad shape, but the only way to get it in him was to put it in his mouth. And I mixed it with some Alamed garlic tincture. And even though he couldn't swallow it, it was still having an effect because of getting under the blood vessels under the tongue. And that was pretty good. Within like 20 minutes, I was seeing it take effect. And then after about an hour, he was beginning to be able to swallow better, and I put it in honey. So anyway, and then I also gave him hawthorn and ginkgo and astragalus tinctures. And I put one of the other things that I did for him, because he was very agitated and aggressive. He was trying to fight us. And so I have Melissa essential oil, a lemon balm. And I put that on the back of his neck at the base of his skull. And then I followed that with frankincense. And I did the same to the bottom of his feet. And that was incredible too. Within about 10 minutes, his aggressiveness had just dissipated. And he was much more compliant. In about 20 minutes, he was asleep. which,
Wow.
you know, when someone's having a stroke, or it turned out it was just a TIA, even though it was pretty severe symptoms, you might not necessarily want them to go to sleep because you want to monitor what they're doing. But the Melissa was so powerful, it just calmed him right down. So anyway, so, and then this time I had gone and got the tincture, the cayenne tincture. So that worked. That worked like within 5 minutes. It was just remarkable.
Okay.
Watching them. So anyway, that's just a testimony for the tincture.
Thank you. Thank
There is
you.
another question.
God bless you.
Thank you for your prayer, Joyce.
So, there is a question about cavities or to prevent root canal. I think Gabriel Arruda, he was our speaker last Sabbath, right? He's writing a book on cavities, how to reverse cavities. So you might want to contact him. He has a ministry. Just Google it. Gabriel Arruda. He has a YouTube channel also. But I just want to say for gums issues, gingivitis, and to prevent cavities, I've used charcoal for many years, for almost 10 years, because, you know, when I left my job in Texas to open up this ministry here, I didn't have insurance, so I didn't want to have cavities. So what I did after I brushed my teeth and floss, I paint my teeth every night with charcoal, and I travel with it every night. And I used to have cavities every 6 months. They had to fix some type of cavities. Since that time, I never had a cavity. As simple as that, as cheap as that. It's just painted with charcoal every night. And so that's, I don't brush it because I don't want to remove the enamel, right? It's a little harsh, but I just paint it and leave it like that all night long. And I do the same thing for my grandbaby. I just painted his teeth every night. So I don't, her teeth every night. I don't, you know, do it harsh. I just paint it. That's all I do. And her teeth are nice and white. So,
yes, but not at night. Not at night. Everybody, I just want you to be aware, you're not going to look pretty at night.
You can hardly see it. You know, do it before you go sleep. You're not going to walk around the house with that. It'll be funny, yeah.
So,
yeah,
you know, I use supercharged silver. It's not a colloidal silver. It's a nano supercharged silver. And that's actually, I have it in a bottle and I spray my mouth with it. And that's all I use for when I clean my teeth or brushing. It will not kill good bacteria. So that's really important for the mouth, because the mouth has a microbiome that's really important as well, but it will kill bad bacteria, the kind that make more of the plaque. And so the bacteria that's causing the decay, you know, using that supercharged silver would also help. And just talking about strengthening your enamel, horsetail is high in silica. And so you can grow your own horsetail. It needs a lot of water and it'll grow like a weed. But if then you dry it and make it into a powder, you can do the same, like you said, how you paint your mouth with the charcoal. You can do the same. You want to be careful because it is very abrasive. But if you'll just put it in, or you take the horsetail and chew it, it actually remineralizes the enamel. It will not remineralize the dentin, but it will the enamel.
That horsetail, I did have a lot of that at my old house too. It does grow like a weed.
Yes.
It will take over everything.
So put it in a pot where you can control it, you know,
Yeah.
so have it in containers.
Yeah. And
somebody was asking,
what about watery eyes?
what about what?
Watery eyes, Tayana's asking.
Okay. Can we finish the other one? Somebody's still asking about the painting for how long. I just do it one time, you know, just I wet I have a toothbrush special for charcoal. So I just wet it after I brush my teeth and floss. And then I just tap it with the charcoal. I just paint it like this, go in and out of my teeth. And that's it, one time. And somebody else was asking about that. Paint teeth with charcoal with fingers. No, yeah, okay. It's when with the toothbrush. Okay, so we can go for watery eyes.
Before we do that, can we do this last one? Because we were going to talk about urinary tract infections. Because a lot of people I've noticed are on antibiotics quite frequently for urinary tract infections. Are you noticing that a lot of women are having to be on an antibiotic like every month, every other month for these chronic urinary tract infections? I have a lot of patients who come in, it seems like, with that. And so we just wanted to talk about that a little bit. One thing that we might want to be aware is that it's not normal to have chronic urinary tract infections. And so if you're having to be on an antibiotic all the time, that's something that, you want to try to figure out what is causing this issue. When you're on antibiotics all the time like this, Dana is saying cranberry juice. And, but you do want to look into why. I mean, so I think Hyun is on here. Dr. Hyun's a dentist, and she had a parent who had this kind of issue. So we did try something for her mother-in-law. Is that okay if I mention her, Hyun, or if you prefer not? I didn't even ask you.
They're relatives, and she's resistant to all antibiotics pretty much, or sensitive to them. Already tried an IV drip in the past. It's a recurring, an elderly lady. My dad diagnosed there's most likely folds in the bladder that's keeping things from clearing out. So Dr. Joyce gave me all those, teas and drinks that helped. Hot, colds, contrast, and I asked them to do a charcoal poultice over it. And then when they did the charcoal poultice, it finally completely went away, and the fever came down.
Okay, so for you felt like the charcoal poultice was the most helpful thing.
What it is the first couple of days they didn't do the charcoal poultice and did all the other drinks in the hot cold. The grandma was kind of stubborn and didn't want to do the charcoal. And it was starting to improve. The fever was getting a little bit better. And then second night, overnight, fever went back up. And so we really assertively said, you need to wake her up and do the charcoal poultice now. So they did the poultice, and then after just that day, after the charcoal poultice, she slept with it on. And they did a urine culture and it came back negative. And several days later, fever subsided completely.
Okay, thanks so much for sharing. I'm gonna share this. So what we did was we did hot and cold contrast fomentations directly over the bladder, or contrast shower if they can't do that. And you want to make sure that you sleep for 30 to 45 minutes after treatment. We do different teas like turmeric, ginger, garlic, onion teas throughout the day. Then that lemon garlic drink 2 times a day. That's where we blended up two raw garlic cloves with lemon, and you drink that twice a day. Charcoal poultice overnight. And this was the garlic, the 2 to 3 cloves of garlic with the juice of 1 lemon, 3/4 cup of water, blend well, drink 2 to 3 times a day. So
Can I just pick something up on that?
Go ahead.
Yeah, we used to live in the Philippines. We had lemon trees, and I thought, because we had so many lemons, I didn't think you could overdose on lemons. So I drank 2 cups of lemon juice a day.
Fix it.
I ended up with UTIs every time I did that. What happened is it will alkalize the urethra because the pH is so alkaline, and it will allow bacteria to go up and cause a UTI. I know you've only got one lemon, so you know it's probably not going to be a problem. But
3 lemons.
every
3 times.
time I did a sitz bath, it kicked it out in 10 minutes.
Yes.
So what the sitz bath will do, it will change the pH of the mucosum lining in the in the region of the urethra, and it can even affect the kidneys, and that will increase lysozyme activity, and that will destroy the bacteria there. So sitz baths are one of the best things to take for UTI. You can also try herbally. There's corn silk is another one. Uva ursi is another one. There's some of the best herbs to take if you have a UTI infection. But try it in combination with the sitz bath.
Yes.
Like you'll be surprised. In 10 minutes, it will knock it out. It's just amazingly quick in its effectiveness.
Mercy has a story with that for her grandchild too, huh, Mercy?
Yeah, because a baby you cannot give them much, so we just put in warm water as hot as she could tolerate, and yeah, that helped a lot. I mean, that did it. Yeah, excellent.
Yeah, so sitz baths are also very helpful.
Yes.
Yeah,
Excellent.
thank you for mentioning that.
Yeah, it's good to know because we don't want to overdo even on lemon, right?
Yeah, I didn't know that you could overdo it on lemons.
I didn't think either. I can tell you, every time I ate too much, drank too much lemon, I would get a UTI, and I didn't figure it out till later.
See, we learn so much through these natural remedies, right? We learn about temperance, even in natural remedies, huh?
So Joyce, can I add something?
Yeah, what was that? Dr. Diane and then Dana?
Yeah, I just, I like the supercharged silver. And, I think I want to balance that with, the times that we're living, and you're thinking of when you're not going to have access to some of the things like supercharged silvers, not going to be readily available. You can get, if you have a colloidal silver machine, silver colloidal, you could do that. But the supercharged I buy from a company out of Utah. But that's what I use just extensively, especially for my mother, where doing a sitz bath is impossible. It would be good with fomentation, but she's chronic. She's incontinent, she's bedridden. And so I give her about 1/3 of a cup of the supercharged silver with a teaspoon of D-mannose. And that's a sugar that's not absorbed by the body and excreted in the urine. And it does what the cranberry juice does. It prevents the bacteria from adhering to the bladder wall. And if a UTI really kicks in and starts affecting her, the main symptom I noticed from her is somewhat of a psychosis. And it took me a while to figure out, but if I give her some charcoal, and I can get charcoal water down her, even just the supernate, within about a half hour, all those symptoms are gone. So, and the reason that is because the UTI is producing inflammatory substances, your prostaglandins and cytokines, and the charcoal will help absorb that just from taking it internally. So that's something I like adding for the symptoms of UTI, when you're achy, you feel like the flu. So charcoal, add 2 hours away from the supercharged silver. And then any of your antimicrobial things like what you're talking about, sometimes golden seal, or I don't use grapefruit seed extract that often because it's such a highly refined supplement. But if a UTI really gets kicked in, I'll do maybe a little bit of it for the first 2 days or so to get on top of it. And then some type of calming herb like catnip or any of the calming ones to help the spasticity of the bladder. I'm not, the cramping, the spasms and the pain. But that usually takes care of it.
Mhm.
Giving her using the supercharged silver and Manos.
Mhm. Awesome. We only have 2 minutes left, and we had to go back to the eye issue that Diana was asking about watering eyes, and somebody else asked about burning, blurry eyes. So we can just answer that and conclude with that question. I just can say really quick for infections. What we do is this is why I talk about cleansing your eyes with cotton and salt water for infections. That's very effective. And also what we do is we put an onion, the inside of a layer of onion in the eye and just tape it overnight. The next day is going to be good. But, I will do it for more days, like maybe 3 more days. But anybody had anything to say about how about watery eyes? Other than hydration. Sometimes that's an issue.
Yeah, I would use some hot fermentations to the eye, because sometimes the ducts, they get blocked.
Oh.
And they need to open up. Often a lot of these things are environmental. I've had people with watery eyes because the gas stove is causing that problem, or and some other people, it's an irritation, a chemical irritation in the eye.
So you do hot and cold?
Mostly hot, moist heat to the eyes. You could do hot and cold, but moist heat generally within a few minutes can unblock that.
Okay, awesome.
Another thing you can do with the ducts is gently massage upward. A lot of times if there's anything plugging it, you can gently express that out when you massage upward like that.
Awesome.
Yeah, when you have dry eyes, though, it just like everything else, it's a local manifestation of a systemic problem, right? And so when you have dry eyes, it's inflammation. You have to change how you're eating, that type of thing. One thing that really helps is adding something like a flaxseed, omega-3 fatty acids, and that's going to really help with these inflammatory conditions, and it will help with something like dry eyes as well. The other thing that you want to look out for, if you're having dry eye symptoms that are really severe, you might want to look for, again, at the spinal cord, trigeminal ganglion, look to see if you have any even, neck issues, that type of thing. It might not even be pain. It might just be that your trigeminal ganglion is affected somehow. And so, again, that can be the bite. All of those things can affect this. So
I want to throw in, Joyce, for dry eyes, castor oil. Castor oil is really soothing and helpful. Some people use it as well for the reversing cataracts, but you would think it would be kind of sticky and oily, but I've been using it. I got dry eyes immediately after going into medical school and being vaccinated. It was just part of the autoimmune response. So, and it hasn't come back. So, but the castor oil is very soothing for dry eyes. And I also want to mention trying charcoal poultices for drying out if there's something obstructed in the tear ducts, or whatever with that the tearing, the watery eyes. So charcoal poultices.
People are wondering, can you put castor oil in the eyes? You can put castor oil in the eyes. You can even do like honey water and that kind of thing. Those things are all going to help soothe. And then you just have to know that the root cause, you do have to identify why are you continuing to have inflammation and deal with that too.
But you would like close your eyes and put the fermentation, right? And then, you have to be careful with your eyesight, right? Okay. I think it's 5:02.
It's 5:02. We should
And,
close.
do you want to announce what we're gonna happen? What is gonna happen
Next week,
inside?
we're going to talk about natural remedies for chronic conditions. So this week we talked about natural remedies for acute
Yes.
situations. So next week is for chronic conditions, and it will be. I asked Dana. It's going to be similar people. Lee, can you be here again too? And
Sure. Yeah.
oh, good.
Can
So
I
it's
quickly mention something?
yes.
It's relevant to the topic. Just this week, we're planning a seminar that's coming up in April, the 4th to the 9th. We're having 40 hours of training on herbal remedies and how to make natural remedies. And part of that's actually going to be like a herbal first aid kit, learning how to use herbs for anything. I mean, common complaints to all kinds of things, but it's specifically also helpful for people that want to actually learn so they can actually do this in real life or have this as a type of ministry, right? So if anyone's interested,
Where do
please
we
reach
go?
out to me. I'll give you
So
more.
where do we go for that? Can you type that into
I'm
the
actually
chat?
doing it. I'm doing it hands-on. We're actually hiring a facility near the beach out here. We're only taking 12 students, but we can have as many students as we want online. So we're gonna be making that available as well.
Are you going to charge people for that?
There will be a charge to that, and I'll give all the details if people want to reach out to
Can you
me.
please give us a
Yeah.
link?
So do you want to type it in, like how we contact you for that?
Yeah, just my email address or my phone number. Let me put my email address there.
Or people can go to theamericanherbshop.com, right?
Yeah, they can reach me through there. It's just not advertised.
Yeah,
There's only
American
people
Herb
that are
Shop.
curious. Yeah,
American Herbal Shop or Herb Shop?
Herb Shop.
Herb Shop, and that's with a
SHOPPE.
SHOPPE.com.
That's